Welcome back to ABC 7 at noon. This month, very special Migraine Awareness Month. Joining us to discuss all your migraine questions is Dr. Blake Busey with Texas Tech Physicians of El Paso. Thank you so much for joining us.
Not a problem. It's my pleasure. Thank you.
So first question here, what are some different ways that migraines might present themselves? Could any of us have a migraine and maybe not realize it?
It's actually a really common type of headache. Some people don't even have a headache when they have it, which is quite frustrating from a diagnostic point of view. But in general, if you had a classic migraine, you usually have something called an aura. An aura can be sound, it can be smell. Most likely it's going to be some type of light shimmer that you have. It's then immediately followed by a really terrible headache. Usually it's one-sided and then generalizes across the entire head. Once it generalizes, people have light sensitivity, sound sensitivity. They desire like cold, dark rooms to avoid any worsening of their headache. A lot of people suffer with this type of a headache, and there are a lot of different procedures as well as medications that can help. But my favorite ones are the ones that don't follow the mold. The abdominal migraines, the hemiplegic migraines, they're very interesting. So imagine only having a headache in your stomach versus having a headache that looks like a stroke.
Either way, they all sound pretty brutal to me, and when you're going through one of these, they can be the worst. What advice do you have for someone who's going through one kind of at that moment, a home remedy they might be able to try?
Yeah, so there's been a lot of studies on what can work over the counter versus what can be prescribed. If you're experiencing migraines infrequently or they're somewhat mild or moderate in intensity, Excedrin migraine is a common medication people use. Some people get better with caffeine, some people get worse. So finding out what that is. Avoiding your triggers are probably the biggest thing. So smoke, cigarette smoke or other kinds of smoke can sometimes trigger the migraine. Some people it's wine or cheese or chocolate, which most people like. So eliminating things from your diet over time, people don't like that.
And of course, no one wants to give up those things, even though things that we like. But when it comes to chronic cases, people who have this a little bit more often than maybe they should, what sort of treatment options are available for them?
Oh yeah, I appreciate that. So one of the treatment options, of course, are medications that you can take every day. They're called prophylactic medications. They range from anything from beta blockers to ACE inhibitors, valproic acid, those type of things. Some anti-seizure medications work well. But even with those, some people have something called a chronic migraine that even doesn't respond to that, which those people, there's certain procedures that are worthwhile to consider. So in our clinic, we offer the botulinum toxin injections that can prevent migraine. The other ones are the CPRG blockers that have been coming out. There's several of them that have come out now. Those are monthly injections. We're currently working on getting that availability here, but me being a family physician, it's weird enough that I do the botulinum injections or the nerve blocks that I do.
So a variety of different treatment options. Dr. Busey, thank you so much. This is all very helpful information for, I'm sure, so many of our viewers. Thank you.
Yeah, not a problem. And one of those other medications that are supplements that people can try if they are having migraines chronically is feverfew. It's an over-the-counter herb. So people that don't trust medicines, there's herbs for that.
Again, a variety of different options, so many so, and obviously a lot more research for many of us to be doing. Again, thank you so much for joining us. Stay with us. We'll be right back.